So today we're going to take a little tour of your spine. This is a couple of lower back vertebrae as viewed from the side. These bumps are along your back, and the front part of the vertebrae here. In between the vertebrae is this disc, which is a nice soft cushy material to absorb shock and impact. As you can see, as we compress down on the spine, the disc takes that load. Between the vertebrae is a little hole here called the foramen, and that's where the nerve root comes out. And this nerve in the lower back would go down into our hips and down our leg. And when we turn around and look at the back, the little sections here in the blue are the joints between the vertebrae, here and here, and that's actually where we get our movement from. The vertebrae move back and forth by sliding motions against those joints. The joint movement here is pretty important because it keeps the joints nice, healthy, and lubricated when they move. It's also really good for your disc there because when the joints move, the vertebrae move, and the disc gets fluid expressed in and out of it, which again helps keep that disc pretty healthy. So when you're lying on your stomach, what I can feel along your back are the bumps here called the spinous processes. And if there's some stiffness in these joints, often we'll find some tenderness along the tip of the vertebrae. Can also go a little bit to the side and push a little bit on either side of those bumps, and we are on the facet joints. And when those joints get tight, they are tender, and the muscles around tighten up to guard it or protect it, and we can feel that tightness. So as I'm doing that assessment, I'm checking for the position of these tips here, looking for swelling and edema there, looking for any swelling and edema over the joints, and the tightness of the muscle that will happen when the joint is really too stiff or not moving as much as it should. As we look straight down, of course, we see the spinal cord, and we get a nice view inside there of the disc. And the nerves, as we said, come out between the vertebrae and go down the leg. So there's our brief little tour of the spine.